The future of pelvic floor therapy businesses, whether or not you're online or in person. This is for you today. You're going to want to listen because I want to talk about what I believe in 2026 and 2027 is going to be the future of pelvic floor. Now, for those that know, I have coached over 400 pelvic floor practices across the US, so I have a pretty good glimpse on what is happening in the market, whether or not you're in a small town, big town, low income, high income area. I pretty much have dealt with it. Whether or not you're all online, I coach people all online, I coach people hybrid. So I have seen a gamma across the board, and I'm breaking it down for you today on what I believe is what every single person needs to be doing going forward in 2026. So let's break it down. Number one, most of us are still doing one-on-one sessions. Now, I believe there is still a need for that. I don't believe that is going away. I still believe people want certainty. I've said this before and I will say it again. What I have seen is people will pay $30 for an app, $30 a month for an app, but they will also pay $3,000 to come in person. Okay? Why is that? And I look and it's the same exercise that we're giving them in person compared to what's on that app. Why would someone pay $30 versus $3,000? There's only one reason: certainty. They know and trust you as the provider and as the doctor. They're more certain with that than using AI, okay, or than using an app, because the app is not specific to them. So the benefit that we have in person right now is that we can provide certainty. Now, the same can be true if you are doing teletherapy or virtual coaching online. You are providing certainty compared to the apps. And yes, they can go on YouTube and look up all exercises, but this is what I say to them. You can go do that, but A, there's not a clear plan. B, you don't know if that's, for you specifically. C, you don't know if that's going to be hindering you or helping you. And so that's why they need a human or AI assistance to help be able to assist them on the progress and also be able to say, yes, this is the path for you with certainty. That's what they're paying for. So I still believe one-on-one is good because I don't believe overnight people are going to be like, let me get healthcare from the internet. However, let me say this. I am seeing a shift, and I'm talking about many other medical companies. For instance, there's something called Rhythm. It's a blood test from home. You put it in your arm, and literally within 2 minutes, it fills up the vial of blood. You literally just mail it off, and you get your results back. And it's actually pretty legit. It does measure your hormones and all things. So it's actually like, because some blood tests, depending on what blood test, only measure certain things. And this one I liked. There's also another one called Function. I did this as well. It is about $2,000 to get your blood drawn. But there's like 40 vials of blood they take. No joke, in a pee test. That being said, it is also hooked up to an app. So you get all your results, and then their AI that they have built out says you need to be on these supplements based on your blood work. We're going to create you a plan for eating. We're going to create you a plan for sleeping. We're going to create you a plan for, it has everything, and just from the freaking app, and a doctor is not present. Now, here's the thing. I actually like it because I don't have to go to another doctor. I can do it from my home. And this is where I believe people are going to be moving into. I believe some people are there, and I believe the majority of the population is not there yet, but I believe we are moving into that because I'm seeing it faster and faster and faster. Okay? When I got the results personally from Function, I was like, oh, okay, this tells me the supplements. Now, supplements, they're not really harmful. You can go out and get those. It's pretty easy. But some of the stuff that was like some heart stuff that was on there, I was just like, okay, well, what does this mean? So it actually, to me, would need a provider rather than asking the AI, hey, what does this mean? So personally, I would prefer to go to a doctor that actually knows, more about this than talking to AI. Some of y'all might be like, nope, AI all the way. They're going to tell me the most amount, information. I think you can look at AI, but I think people still want to consult with an actual provider. Okay. Now, of course, that can change. Of course, the provider could be in your pocket. And I'll get into that in a second. Okay. So What's another? The wearables. The wearables are coming very popular. Whether or not you're ovulating, whether or not your menstrual cycle, whether or not to keep up, like when are you gonna have your menstrual cycle? There's just so many wearables coming out that people are consuming from home. I'm trying to think of another example that I was like, oh wow, you could do this from home. Oh, my body blur. So instead of going to a spray tanning, you get a spray tan, guys, you can literally just, it's not like self tanner where it gets all over your hands. It's like a brush and it literally just like blots your skin to make you look tan. And in 2 seconds, they now have removed you having to go to the tanning salon and get sprayed, by a lady where you don't need the lady anymore. It's just in a bottle and you put it all over your skin and now you look 10 times tanner and you look like you got muscle. Okay? That's insane. So all this stuff is coming in-house. And I believe we need to be prepared for it, but I don't think 100% you should switch your model today and go immediately. If you don't do online, immediately just jump ship and go online. Okay? And I say this because if you go online, and by the way, I believe every single person should be online. Okay? I believe you should have both, because that's when you really can vertically integrate and capitalize on both markets. Okay. And I have some clients that are just virtual. I have some clients that are just hybrid, and I have some clients that are just clinic. But I prefer hybrid because we can just amplify it. That's what I've just seen. Okay. So that being said, if you go online, you have to be the most online marketer genius that's ever lived. Meaning you have to learn new skills. As providers, we do not have these skills. No one teaches us this. But you have to learn new skills to then be able to go out and get people to know, like, and trust you. And this takes time to build up online. The fastest way to do it that I have seen is virtual workshops or virtual groups or virtual community meetups. Something where you get community involved and you get multiple people involved in your business. And I believe going forward, every single person should have some kind of community and charge a fee for that. So whether or not it's a $20 fee to join your community, $30, just something so that people are like, oh, cool, I'm part of this. This is where I'm going to ask my questions. This is where I'm going to hang out. And they feel and they belong. I believe two things are going to happen in 2026 and 2027 in the healthcare space. Number one, I believe community is going to be king. It always has been, but I think it's going to be more apparent. And number two, I believe every single company should have some sort of AI/assistance in their company. They're going to have to. Even right now in 2026, I see it. You must. It's like not even a maybe. You must have assistants that are agents in your company with the CRM that is built out completely. Otherwise, in 6 months from now, you will not be here, because everyone that has the agents can outcompete times like 10 a company that doesn't. And I'm just telling you, I'm like, this is a warning sign. If you do not have a CRM, which basically means, for those that don't know, it basically means that any patients that call that do not book with you, we can re-nurture them and get them to come back in. They may not come in that day, but we can do that. We have email series built out. We have what to say and scripts built out. We have everything built out in a system to help you guys be able to accelerate. And this took me over 2.5 years to freaking create. And I can't tell you how much on payroll, probably at least over 100K on payroll, at least maybe even 200K on payroll. And y'all don't have a lot of that money in these days. And then also you don't have the time. So we have that and we give it to you guys because it will help move you and be able for you to focus on the actual tasks that can move the business forward while this is working in the back end. Then in addition to that, we've created social media bots where it actually posts your posts for you and does all the thinking for you, geared to your SEO and your brand and your company. So that way, again, you're not sitting there, what should I post today? It is doing it for you behind the scenes on all platforms. Like, how cool is that? No one has this. We literally created it. And I've been working with an engineer guy for the last 4 months on this, okay? That's another thing that you need in your business. We also run ads, Google and Facebook ads. We do both. Okay. So that if you want to amplify, but everything else has got to be tidy behind the scenes. And if that's tidy, then we can amplify and throw money at ads. Okay. That's the next thing we do to help amplify the business, to get your name out there, to make sure. By the way, ChatGPT is going to start coming out with ads. So instead of doing Google ads, there may be some ChatGPT ads that we might be throwing in there, because that is the next wave of where people are getting their information on. And so we want to make sure we stay on top of it. What else is happening? The next thing that you need a full marketing system. Okay. If you guys have admins, you need a full training admin system that allows you to feel confident in your admin, and the admin not be the bottleneck in the company, whether or not they're virtual or whether or not they're in person. Okay. You also need something that's a lower price offer. Most of y'all don't know how to do this. This is what I found. You do not know how to downsell. You do not, well, I shouldn't say that. Sometimes you downsell indirectly when you shouldn't be downselling. So let me give you an example. You have treatment sessions that are like $200 a session, and you're like, well, I'm just going to do like $70 for dry needling, and they could come in for 30 minutes. That's a downsell. You don't know you're downselling, but that's a downsell. That is something that I do not do, because you're basically devaluing yourself, and you're getting paid even less per hour than you would be making 200. So I do not recommend that. What I do recommend is you can upsell dry needling. So you charge $200 for the session, and then you charge $15 because for the needles to cover the needle costs. Okay, it's an upsell. Now you also need to know how to downsell in the appropriate scenario and situation. Meaning, let's just say someone calls and they are like, I can't afford $200. I'm sure you guys are getting the objections. A visit. Okay, great. Well, now how do you downsell that? And you need a different offer to downsell them at like maybe $1,000 with a payment plan, or $1,500 with a payment plan that actually will deliver the same result as if they were in person. Now, here's the problem with this. Most of y'all are not confident enough yet to know that the same result that you can get with your hands is the same result that you can get online or through a program. Okay? I promise you, it is the same. Okay? We specifically have protocols that I have written out per condition that I have strictly just done online for many, 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 many years. Okay? And I've gotten the people the results. And so I have proof of that. Most of y'all don't have that written out. I have it written out. Okay? And I execute it. And so with that, we give our clients that protocol, so then they can go and create a program on that. With, again, that took me at least 6 months just to create the formatting of that, to figure out like, what would I do in this week? How would I do this? How would I structure it? Okay. And we give that to our clients so that they can build out a quick program, and that they can have a downsell to then be like, okay, this doesn't work, but you really want to get this problem solved. No problem. We're going to give you this. Here you go. And that's it. And so I believe you're going to have a downsell. I believe community. I believe you're going to have to downsell. I believe your systems have to be so dialed in. I believe you're going to have to decrease your payroll. And systems have to be so freaking, like I said, the systems have to replace the people. That's how this is going. We've seen it in large companies. It's not just like the blue collar workers. It's like the big CEOs. They're also decreasing. I've just seen it. It's here. So it's been here. And so you also, need a strong, 3K offer, and then you need to know how to upsell. And when I say upsell, I'm not trying to sell anyone and pull wool over their eyes. I'm trying to actually truly solve their problem. And some people need hand-holding. That's the 3K people. Some people are like, you know what? Just tell me what to do. They're the ChatGPT people. I just need to know if this is right. Okay, cool. I need your consent. Is that good? Like, am I doing this right? Okay, cool. Well, then fine. That's the downsell people. Okay. There's two types of people now that are, I feel like are very obvious. And also, you can put yourself in their pocket. Okay. We've done this. My clients get me as my clone. Okay. And they're very happy with it. It sounds like, oh, AI, but they get me in 2 seconds. My thing answers just like me, same voice, all the things within 2 seconds. They have a question at 12 o'clock at night and I'm sleeping. Guess who they're going to ask? My digital clone. Y'all can do the same thing for your clients. You can clone yourself. And so when they have a question, they can ask your clone, and that's part of your membership. And so if you guys want this and you want more of this, please reach out to me at Pelvibiz, Pelvibiz, at Pelvibiz on Instagram. Just say, hey, I need help with systems. I need help with, structuring this. And I'd be happy to, help and see how, like, where's the bottleneck in the business and how to make this more proficient so that you can keep up with the times and be able to stay in business. Okay. I literally had this week 2 people that are pelvic health providers that have been practicing for, one was 14 years and one was 7 years. Okay. Both of them are about to close their door. Both of them are about to close the door. And I was on the phone with him and I was like, no, you got to do it this way, this way, this way, this way. And they're like, oh my God, I didn't know. And it's because they've been doing the same thing. Guys, if you are in business, I can't say this enough. I didn't really understand this when I first started. They always say, break the business. Like, what the heck does that mean? What it means is every single year you have to level up. And if you personally are not leveling up, you cannot level your business up because you will not have the energy and bandwidth to do that. And so you personally have got to build energy and cultivate zest for learning. By the way, if you're an entrepreneur, you signed up for a freaking lifetime of learning. You always have to learn to be able to stay on topic or on trend or where things are going. You always have to be learning. And it's not like I watched this module, now I know everything. No, it's like actually doing the hard thing to make the thing work. Like if y'all don't know tech, you got to learn tech. You have to learn tech. If y'all don't know social media, you got to learn social media or just get the bots that we have. Okay. You don't have to learn social media then. But like, that's the stuff, just so you know. Okay. So, hopefully this is helpful, getting you guys in a direction on where you need to be going to make sure that you hyper focus on actually what's matter. Upsell, downsell, community, you definitely need. Those are key. Okay. So hope you guys enjoy this and we'll talk soon. Bye guys.